for BRCA1 mutation carriers, really the most probably important cancer risk is breast cancer, which is actually similar, right, to BRCA1 women. The big difference is that for BRCA1 carrier females, the cancer risk of breast cancer is, upwards of 60 to 80% over their lifetime. Whereas for male BRCA1 carriers, that risk is about 5%. The thing is that it's so highly elevated over the general male population, as only about 1 in 1,000 men will get breast cancer. So it's not something that men are as aware to think about, as women would be who are getting mammograms and those sorts of things. And so even though the absolute risk over a BRCA1 carrier's lifetime is not that high, that 5% is high when you put it in context. In addition, male BRCA1 carriers are at increased risk for pancreatic and prostate cancer, which is similar to BRCA2, but not quite as high of a risk as in BRCA2. And so they sort of flip-flop. So for BRCA2, the most sort of highest cancer risk for BRCA2 male carriers is prostate cancer. And so that risk can be upwards of 50%. But there's a big range between BRCA2 male carriers in their risk of prostate cancer. That's different than BRCA1, which is probably a little bit lower. But again, I'm hedging quite a bit because we do actually lack quite a bit of data on, the really specific cancer risks in this population. And then finally, pancreatic cancer affects both males and females with BRCA1 and 2. That risk is maybe 3 to 5% in individuals with BRCA1 and 2 mutations, regardless of gender. So those are the major risks associated with BRCA1 and 2. And we often also say, too, these are genes that are involved in overall suppressing of tumor formation. So there may be other slight increased cancer risks that we just don't have enough data yet to really understand